Learning English with English faculties.
Welcome back, focused learners. I'm absolutely thrilled to jump into today's explainer because we are tackling a topic that I know is a major hurdle for so many incredible healthcare professionals. Today, we're totally demystifying the OET speaking test. We're going to break down exactly what the assessors are secretly looking for and equip you with the actionable tools you need to confidently lock in that all-important grade B. Because let's be real for a second here. Why are you even putting yourself through this test? You're not doing it just for fun, right? Earning your required score on the occupational English test is literally the key to unlocking your dream healthcare job in English-speaking places like the UK, Australia, Ireland, or New Zealand. A grade B is exactly what most regulatory bodies demand to guarantee you can provide safe, high-quality patient care. So acing this, it's not just an English test, it's your entire future. Okay, here's our roadmap for today. First up, the speaking test format. Second, the 4 linguistic criteria. Third, the 5 clinical criteria. And finally, exactly how to score that grade B. Part 1, the speaking test format. So, the whole speaking subtest, it takes roughly 20 minutes from start to finish. And during that time, you'll be doing 2 completely profession-specific role plays. What does that mean? Well, if you're a nurse, you do a nursing role play. If you're a doctor, a medical one. And the interlocutor, the person you're actually talking to, they'll act as your patient or sometimes their carer or family member. Here is exactly how that 20 minutes is sliced up. You start with a quick warm-up talk. Honestly, don't sweat this part. It's not even greeted. It's just to help you shake off the nerves and get used to the interlocutor's voice. Then, for each of your 2 role plays, you get exactly 3 minutes of prep time, followed by 5 minutes of actual speaking. Oh, and here's a massive pro tip. During those 3 minutes of prep, you are absolutely allowed to scribble notes directly on your cue card. Jot down your keywords or your go-to phrases. Moving right along to Section 2, the 4 linguistic criteria. Your performance is actually judged by 2 different assessors, and they use 9 criteria in total. The first 4 are the linguistic criteria, and man, these are the heavy hitters. They're worth 6 marks each. We're talking intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Basically, this is all about measuring how accurately and naturally you use the language. Let's look a little closer. First up, intelligibility. Now, I know a lot of candidates totally panic about their accents here, but listen to me. Having an accent does not mean you aren't intelligible. What the assessors are really listening for is whether your speech can be easily understood by the average person. Sure, they look at pronunciation, but they're also listening for word stress, like how you emphasize important info, and your intonation, like making your pitch naturally rise when asking a question. Then we got fluency. Please don't fall into the trap of thinking fluency means talking like a literal auctioneer. If you just speed run your sentences, the patient isn't going to comprehend a word you say. You really want to aim for a natural conversational speed with a nice, even flow. It's totally fine to pause. Actually, pausing right after you drop a heady piece of medical advice is great. It gives the patient a second to actually digest what you just said. All right, Section 3, the 5 clinical criteria. So alongside those linguistic marks, you're graded on 5 clinical communication criteria, which are each worth 3 marks. These are basically your bedside manner scores. They evaluate how you navigate the human side of the whole interaction. Are you building rapport? Are you picking up on the patient's little verbal cues? You could have absolutely flawless grammar, but if you're talking to the patient like a robot, you are gonna bleed marks here. Take providing structure, for example. Look, you are the healthcare professional here, right? So you have to be in the driver's seat. You're expected to sequence the consultation logically and tell the patient exactly when you're changing topics. Whatever you do, don't just sit there waiting for the interlocutor to lead you. You have to take the initiative. Which brings us to Section 4, how to actually score that grade B. To knock the information gathering criterion out of the park, you've got to master something called the cone technique. Basically, you start your history taking with wide open questions, like, what brings you here today? This gets the patient talking in their own words. What you definitely want to avoid is firing off a machine gun volley of closed questions, asking, do you have pain? When did it start? Is it sharp? All in one breath? That just confuses the poor patient and definitely costs you points. Now, to max out the points for understanding the patient's perspective, you need to actively pull out their ideas and concerns. Asking a super simple open question like, how does that make you feel, is a brilliant way to invite them to share their emotions.
It instantly signals to the assessor, hey, I am a truly patient-centered professional. Okay, let's talk about information giving and appropriateness. A huge, and I mean huge, mistake is relying on heavy medical jargon. Remember, the patient in your role play is an everyday layperson. So if your cue card says the patient has eyelid myokemia, please don't just casually drop that term on them. Break it down into simple, everyday English. Say something like, you have a contraction of the eyelid. Give them advice in bite-sized chunks, and always double-check that they're following along.
Empathy. It's absolutely massive in the OET. Just muttering a quick, I understand, really isn't going to cut it for a top score in relationship building. You want to use validating, truly empathetic phrases. Do yourself a favor and memorize this one. I can see that must have been hard for you. Just acknowledging their struggle without any judgment, that instantly elevates your clinical communication score.
Remember when we talked about providing structure a minute ago? Well, this quote right here is a textbook example of signposting, saying, before proceeding further, I'd like to ask you some questions about your pain. Is that all right? Acts as this really smooth, clear transition. It tells the patient exactly what the plan is and politely asks for their consent. It's basically a magic trick for effortlessly organizing your role play. Now, I really need to emphasize something absolutely crucial. Actually, scratch that. It's literally the most important thing to remember. If your mind goes completely blank on the actual medical treatment for a condition during the test, do not panic. The OET is a test of your English communication skills. It's not a medical exam. You are never penalized for getting the medicine wrong. Every single medical fact you need is printed right there on your cue card. Your only job is to communicate those facts kindly and clearly. So, there we have it. With the whole format demystified, the grading rules clearly laid out, and these Grade B communication hacks firmly in your back pocket, you have the exact playbook you need. The ball is in your court now. So my final question for you is, what empathetic phrase or open question are you going to test out first in your next practice session? Thank you so much for joining me on this explainer. Get out there, practice with purpose, and I'll see you next time.